The route of or combined hormonal contraception, the route of administration is transdermally in form of the patch. This patch is released norgestromine 115 microgram and ethinyl estradiol 20 microgram daily. This patch is applied on the skin of upper arm, lower abdomen, buttock. Packet in the form of contain 3 batch, 1 batch for 1 week, so 3 batch for 3 weeks, and then there is a 1 week free batch. This contraceptive patch have the same risk, same benefits, same side effect of combined oral contraceptive. The main difference from combined oral contraceptive is a better compliance. Mean بدل ما every woman take 1 pill daily, just 1 batch weekly. This is make the patient and the woman more compliant with the contraception. The other route is in the form of the ring, vaginally in the form of the ring. This given combined oral contraception in the form of the vaginal ring inserted in the vaginal ring by the woman itself. It is a flexible ring, 45 millimeter diameter, made of latex-free plastic. It releases 15 microgram ethinyl estradiol and 120 microgram etonorgestrel daily. Inserted by the woman itself, stay in the vagina for 21 days, then removed, and 7 days without, free, interval 7 days, and then inserted again. The woman can be removed by itself, cleaning, and then replaced. Also, they have the same risk, same benefit. However, it's more expensive but make the patient more compliant with this type of contraception than the pills. Combined hormonal or hormonal contraceptions contain hormones, estrogen and progesterone. Therefore, it causes a side effect, and side effect is related to this hormone. Minor side effect is affect central nervous system, make the patient depressed mood swing, headaches, loss of the libido, gastrointestinal, nausea, weight gain, reproductive system, breakthrough bleeding, increased vaginal discharge, breast pain, enlarged breast, miscellaneous chloasma, facial pigment, which worsen with the time on combined oral contraceptive. This minor side effect of the hormonal contraception. However, there is a major risk. Major risk is very important to understanding. Why? Because when understand the major risk of combined oral contraception, we know who patient should be absolutely not take. Know the absolute contraindication for combined hormonal contraception pill. The main risk is a venous thromboembolism. Combined oral contraception is increase the venous thromboembolism 3 to 5 fold, and this is depend about the dose of estrogen. Mean in the usual dose from 15 to 50 microgram, there is no any significant increase in risk. However, when more than 50 microgram, the risk is more higher. Therefore, the dose of estrogen that available in the market is ranging from 50 to 15 microgram. Next point, this risk is depend about the type of progesterone that use. لما نقارن الريسك of the venous thromboembolism in the normal population is 5 over 100,000. In second generation, increase become 15. Third generation become 30 on 100,000. So with increased generation, the risk of the venous thromboembolism is increased. Also with the increased age, اللي عمرها above 35 and above 40 is more liable, is affected more. Obesity increase risk. Patients that have non-case of acquired or congenital thrombophilia increase risk of the venous thromboembolism. Another risk associated with the using of combined oral contraception is risk of myocardial infarction and stroke. However, in healthy young women, the risk is very, very small, extremely very small. Those patients that have this risk, those who are cigarette smoking with high blood pressure, and also with the age of 35 or above, those patients have history of the migraine with the aura. Those patients have increased the risk of arterial disease, and found that around 1% of women taking combined oral contraceptive will become significantly hypertensive, and this patient should be advised to stop taking the combined oral contraceptive pill. Other risk is breast disease, cancer. Breast cancer, however, risk is low, يعني it's not so significant, about 1.24. However, this risk is increased if the patient have background risk for the breast cancer. Patient of 40 and above have strong family history of a breast cancer. They have a high risk to develop breast cancer with the using of combined oral contraceptive pill. And this risk is different, disappear after 10 years after stopping combined oral contraceptive pill.